Let's bring in Dr. Ashish Jha. He's the Dean of Brown University School of Public Health. Dr. Jha, good morning. Let's begin with AstraZeneca for a second. I think a lot of people may be looking at this and saying, well, wait, we already have 3 vaccines. Great if we have a 4th one, but why is this so significant?
Yeah, good morning, Hoda. Thanks for having me on. It is really significant for a couple of reasons. I mean, first of all, it's nice to have a 4th vaccine here in the U.S., but by the time this is authorized, I don't think we're going to be looking for a lot more vaccines here. We'll have plenty, but it may add to our stockpiles. I think the bigger issue is global. This vaccine, there are hundreds of millions of doses of this being made around the world, and we really need to vaccinate the world. Remember, this is a global pandemic, and it will come to an end when the world is vaccinated. This is our best ticket towards vaccinating the world. So I see this as really good news.
Okay, Dr. Jha, let's go back to Miami for a second, those crazy scenes of people just partying it up. We're not going to know the consequences of those actions for weeks, but if you were to read the tea leaves, what would it tell you about what's going to be happening there?
Yeah, Hoda, I'm worried about this. You know, even last March, we saw this with the spring break crowds, that what happened in the weeks that followed was spread of infection across the whole country. Even if young people themselves don't get very sick, usually, they are very efficient spreaders of this disease. And so what's going to happen is they're going to take it home. They're going to infect vulnerable people who have not yet been vaccinated. And that's, I think, what we're all worried about.
I think something that's confusing, Dr. Jha, is that people are listening to their local officials and state officials, and everything seems to be loosening. You can go to restaurants, you can go to sporting events. The masks are, they're lessening that too. So I think people have the sense of, well, it seems like it's over.
Yeah, we're really close, right? Like we're basically at the 10-yard line and we've got the ball and we should be able to run this into the end zone. The end zone, in my mind, is when all high-risk people have gotten vaccinated. Hoda, we're probably about 4 weeks away from that. And I just think we're loosening a little too early. And the cost of this is that a lot of people are going to get infected and sick when we can avoid that by just holding on a little bit longer.
Yeah, and just lastly, I know you want to get a lot of the country vaccinated for herd immunity, but there are some people who just don't want the vaccination. And I was struck by a study that said 30% of healthcare workers either have not decided or do not want this vaccine. So what would your message be to them?
Yeah, well, my message to them is that it's incredibly safe. 80 million Americans have now gotten a dose, and obviously tens of millions of people in other parts of the world. And I think what's going to happen, Hoda, is people watch folks getting vaccinated and doing well. I think they're going to jump off the fence and get vaccinated. And I think that's where this is heading. I'm pretty hopeful that a vast majority of Americans will end up getting vaccinated.
All right, Dr. Jha, we appreciate your time this morning. Thanks again.
Thank you.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.